Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health.
Hello, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me back again, Dr. Hollan Harper, primary care sports medicine physician at Monument Health's Orthopedic and Specialty Hospital. There's always such deep breaths after announcing you guys in a lot of these. And nurse practitioner, Kaleh Knutson. Welcome back, you guys. Thank you for coming back and talking about something I've been preparing myself for. I'm ready.
For sure.
I think. We're going to talk today about a procedure. First off, why do our tendons hurt all the time? Why can't we just grow old and none of this
Mr.
happens?
Houston, you just get old, and it's just they wear out.
Well, so I was reading somewhere that we have 4,000-ish tendons in our body.
A lot of tendons.
Can this procedure fix all of them if there's a problem?
There's a good majority that wear out more often than not. So we focus on very specific tendons, but our tendons wear out for various reasons. There can be injury, they get torn, and then they heal abnormally.
Right.
You can have just slow, repetitive micro trauma to your tendon, and then when you hit that 40-year-old mark, you're like, my shoulder's just killing me, and you get this diagnosis of tendinitis.
Yeah.
And then people are, well, how did I get this?
You lived,
right?
You just got older.
Yeah. Those tendons, they just change their structure, and then they get painful.
Well, we're going to talk about a procedure here coming up that can help with a lot of this.
Right.
And I'm sure, like you were saying, tendinitis, people have heard the phrase, obviously. Mm-hmm. But tennis elbow, golfer's elbow, which I've heard, jumper's knee. Mm-hmm. God, got to get a little more creative with some of these. One I was kind of surprised to see on the list, though, was plantar fasciitis.
Yeah.
I didn't realize that was a tendon thing.
Yeah.
And that's on the bottom of your foot, right?
Right. Calcaneus there in the bottom of the heel. You can have, people are aware of the plantar fasciitis.
Oh, I'm sorry, fasciitis. Yeah,
fasciopathy, whatever you want to say.
Okay.
There. But yeah, it's that irritation of that fascia or tendon or ligament. It's essentially any one of those structures can be painful, and we can do this procedure on those areas.
That's amazing. Okay, so let's say somebody comes in. Let's go with jumper's knee, just because that's the one that cracks me up the most.
Yeah, for sure.
So you have the tendons, and let me see if I can get this right.
Please, I'll tell you if you're right or wrong.
Please, your tendons are attached to your muscles.
Yes,
which are attached to your bone.
Oh my gosh! Yes.
Did I nail it?
This is good.
Great job.
All right. Okay. So
you got it.
I got it. Well, I looked it up like 15 minutes ago. So, so let's say somebody comes in with a jumper's knee, and what specifically would be the problem there?
So, the patella tendon, quad tendon, essentially that extension mechanism in your knee can be painful. And if you have an acute injury where you were playing basketball and you hurt your knee, typically you don't come in and we're like, well, you need Tenex. Typically you do the conservative stuff first, where that tendon, we verify that it's the issue, and then we rehab it. We try to see if your body is going to heal it first. And once you get an inflammation or irritation of that tendon, that's got to kind of happen because naturally your body wants to try to fix itself. Mm-hmm. So if somebody comes in and they just are like, hey, I just started having knee pain, and we feel like it's their patella tendon or their jumper's knee, then we're not going to jump to Tenex. We're going to say, well, let's rehab this. Let's rest it. Let's give you some anti-inflammatories. Let's try these conservative things. And honestly, 80% of the time, those people will get better.
Really? Almost that much?
Yeah.
Okay.
Obviously, depending on what the injury is.
Yeah.
But most of the time, the conservative physical therapy, retraining, re-strengthening that tendon gets people better.
So is it mainly, do you mainly see these injuries in the areas that we use the most, like in the elbow, in the shoulder, in the knee?
Yeah, for sure.
Where else? Well, I suppose bottom of your foot too.
Oh yeah. You could potentially name a tendon, and I've done Tenex on it. But
really?
Shoulder, elbow, knee, hip, foot, and then there's also the Tenex bone, where we can take off bone spurs So there's essentially any bone spur that you could have.
So it's not just a procedure on the tendon then,
No,
per
there's,
se.
there's different needle application tips that we can use, and but again, this is not a one size fits all.
Right.
There's got to be some education on, well, you maybe not qualify, or you haven't gone through this conservative step here, because if somebody comes in and they have tendinitis, that's an acute issue, meaning it just happened and they've got inflammation in their tendon. That doesn't necessarily mean they have scar tissue in the tendon. So if there's scar tissue in that tendon and it's been a long time, like 3 to 6 months, they're hurting and nothing's getting better, and they've tried all this conservative stuff, then Tenex remains an option. Whereas if you didn't have that tendon procedure, and we'll explain it more, but you might have to go to surgery.
Okay.
So
Then I guess let's get into it. I was wondering how long I could put this off before you described exactly how this whole thing's going to work. So you people have come in. You've determined that, well, the therapy that we've done doesn't work. So then I'm assuming you see them first, don't you? I mean, did they come in and when the procedure's about ready to go? Are you
Sometimes.
Okay.
Sometimes, some of our other providers might
Sure.
refer to Dr. Harper for this tendon procedure. I see them a lot afterwards and make sure we're doing appropriate rehab and exercises. I like to tell people Tenex makes this perfect environment for your tendon to heal up properly. Maybe it didn't heal well, with previous injuries or scarred up too much, but this makes this perfect environment. So
Okay. Are you in there when the procedure's happening?
I have been there.
God. Okay.
did you just hear that she said I was perfect?
Yeah, I did. I heard it, and
Did
the
it?
thing is this has been recording on 2 different machines.
Yeah.
So
I think that's what I heard too. I didn't know if you caught that.
yeah, totally did. Okay. So everything's been exhausted, and you're saying, here we go. We're going to recommend the procedure. So
Yeah.
what do I do when I come in there on my jumper's knee? What's going to happen?
Initially, if I'm getting referred for an evaluation for Tenex, I want to verify that the tendon is actually causing the pain. So what we'll initially do before we even do the Tenex procedure is I'll do an ultrasound evaluation of the tendon structure and numb it up. So I'll put anesthetic into that tendon under ultrasound and see if their pain goes away.
Well, I
And
suppose.
it's not a direct correlation, but sometimes people are like, yeah, all my pain's gone. And then that's helpful to know, okay, maybe a majority of your pain is coming from this tendon or this
Okay.
structure. And then we make a decision jointly together to move forward with the tendon procedure, the Tenex.
Now, how damaged can a tendon be? If it's torn, this procedure doesn't work for that, right?
No, if it's cut, I can't put it back together.
Right. Okay.
You need one of my colleagues to
Okay.
go in there and fix it up.
Okay. So it's
There are partial tears, though. There are scar tissue, and sometimes people are not surgical candidates.
Mm-hmm.
They just have too many things going on, or and then sometimes this is an option for even when you have some tears in those tendons.
Oh, wow. Okay. All right. So you've determined that the tendon is the issue.
Right.
And now you've got to pull out the Tenex tools.
Yep.
So what's going to happen?
And then I got to explain to patients, what this device is and what I'm going to do for
Yes.
them. So this device is essentially a needle device, and it is done under ultrasound guidance. And the needle itself is a handheld needle and is essentially attached to a power source. And it's a needle within a needle. What that means is that there's 2 needles there. The inside needle actually oscillates very, very quickly and creates a sound frequency that's tuned to scar tissue. And as that frequency is being emitted, it actually disrupts and potentially liquefies the scar tissue. And then there's an irrigation system that is inside of this needle device that flushes that area. And then the needle is hollow and simultaneously sucks out the debris that I'm loosening up with the device. So it's essentially removing scar tissue.
I got to go back to, I love everything about science. I love everything that it's given us. But you said that this can be tuned to scar tissue. Mm-hmm. How can it know? I mean, do you understand that part of it?
So there's a ton of studies that they have done where they're going to put this needle device next to a healthy tendon, and it will not cut it. It will not disrupt a healthy tendon. because there's different frequencies that all of these tissues are emitting. And you can actually tune that so that it actually will just cut through scar tissue.
Okay.
And there's a specific way that you actually have to do the procedure so you're in plane with those tendon fibers. Because if you just go in there with a needle and you're just scrambling around, you could cut a tendon. But I've never had a tendon cut doing this procedure, and I've done hundreds of them. So
are you just under a local anesthetic for something like that, or does
every one of my patients are awake listening to dad jokes as we do this, and
they're like, "Just please hurry, doctor! Oh God, please hurry!" So once it's sucked out and you deem that this all worked, what kind of how successful is it? I mean, generally.
Yeah, so the data just shows that it's about 85% successful.
Well, that's pretty good. I mean, if you're having any kind of pain, obviously.
And there's a lot of times where people come in and they're having a certain type of pain, but that's why we do the test injections, because if they get 30, 40% better from that test injection, then I can set an expectation here of, well, maybe doing that Tenex procedure will get you 30, 40% better. And then I can say it was 100% successful.
Oh, yeah. Exactly. That's perfect. So I think you hinted around a little bit about what can be treated with Tenex.
For sure, yeah.
And you mentioned bone too, correct?
Yeah, there's a needle application tip where we can actually shave down bone spurs. If you have a really bad bone spur, for example, in your heel, we can actually go in there with a needle device and essentially just shave it down.
What is a bone spur? I mean, in essence.
Yeah, there's various types of bone spurs. You have arthritis. There's so much tension on those joints that the bone actually remodels itself to dissipate the surface tension. So it's essentially just adding in some more support there to offload the pain of that area. And if you have a tendon that is being stretched and pulled so much on a bone, your body can actually essentially make that insertion stronger by putting bone in there, and you'll develop this bone spur that connects to a tendon.
And those can be painful, obviously.
And they can be very painful, especially if it's on the bottom of your foot and you're walking around. So a lot of the time we just take them off and then...
Can you get that anywhere, the tendon is attached?
You can,
then?
And that's another consideration is that you don't want to just, take off every bone spur you have.
Right.
Because, 3-4 months later, it might just come right back.
It can be that fast,
It
too.
can. I mean, it can be very quick, especially if there's a ton of tension and pain in those locations. So we're a little bit more selective on, well, what are we shaving off here with this bone? And, is it going to get you better?
Okay.
Yeah.
What's kind of the recovery time for something like this? Let's say you do a jumper's knee. Then when can I go back out onto the basketball court and be humiliated by people much younger than me?
And get the other jumper's knee and come back and see me. Yeah. So for the vast majority of people, there's no activity of daily living downtime. So someone comes in and they've got a jumper's knee. I'm not putting them on crutches. We're doing that procedure and then they're walking out that same day. But then it's just based on recovery before that strength is regained in the tendon, and just based on normal body, physiology. For a normal healthy tendon to lay down new fiber, you're looking at 50 to 100 days. Now, are you going to fully recover? That's always tough. Mm-hmm. Are you going to have a pain improvement immediately? Probably, because if you're removing scar tissue and that's gone, then you might have within a week better range of motion. We're going to restrict you a little bit for that first week because the incision site has to heal. You've got some steri strips over this site. Kaleh sees you a week afterward and makes sure that everything's looking good. And then we're going to start you into some therapy and just gradually progress that.
Okay. So, Kaleh, then you help with the kind of the therapy side of it too then, or at least kind of point people in the right direction. So, so what's it look like for you then after it's done and they come back and they're ready to start healing?
Yeah, so the first visit is, like he said, looking at the site, making sure everything's healing okay, giving them advice on how to care for that site. And then we have a discussion of physical therapy versus different other home exercise programs, things like that. Sometimes while he said there's not, major restrictions, if it's an upper extremity like an elbow or shoulder, we might have them limit lifting, and then we might slowly advance that over the weeks to come. So 1 week out, pretty easy visit. 6 weeks, we kind of see how you're doing. Some people after the first week aren't always exactly sure how they're feeling. They might have some inflammation or pain right afterwards, but often they're like, wow, this is different. This feels good. I can actually put my arm above my head now, so that's super cool. And then, again, we really stress the physical therapy. Like I said, it makes this perfect environment to heal the tendon. So we have to stretch the tendon and remind it kind of how to lay down those normal fibers. So then at 6 weeks, we check in, see how things are going, and then often by the 3-month mark, people are doing really, really well.
Oh, that is pretty amazing then. I mean, it does seem really, it seems quick, honestly. Do you ever have to go back and kind of work on the same one if it doesn't quite?
Super rare.
Is it?
Yeah.
Okay.
I mean, the 2.5, 3 years that I've been here, there's a couple that we've had to go in, but it's not necessarily in the same spot. We really, we might have to do a different tendon in a different location. And then when people come back, it's always interesting. Well, I'm not any better. Oh, well, where's your pain? Well, it's in this location now. Okay, well, that's a different location.
It's a whole other thing, yeah.
Yeah, and that might be, well, we might need to work on that. And that's the other side of this is that this isn't taking away, from my colleagues that do surgery, where surgery is indicated, and I work very closely with them.
Right.
Because, there's still about a 15% failure rate where this doesn't get people better. And then they might have to go on to that surgical intervention.
Right.
Yeah.
Do muscles and tendons, do they heal quickly in general?
How old are you when this happened?
Not telling. But just as far as that part of our body, do they heal quickly, or are they?
I think that's a loaded question
Sure.
because it would have to be based on, well, how big is the tear? Where is the tear? Where's the muscle group you're using? Can it rest? Is it so? I don't know how to answer your question specifically, but things are supposed to heal in your body.
Right.
They are. But sometimes they heal weird. They heal abnormal. You don't have the same tendon fibers, that you had 10 years ago. So the healing and the expectation that I'm going to be, 20 again with this procedure is not the case.
We're not there yet.
Like preventative, what can people do for tendons and muscles and things like this? What can they do to not have to see you?
Yeah, so there's specific exercises for tendons that stretch the tendons. And I think people get caught up into this, well, I need to make my muscles as strong as they can be.
Some people worry about that. There's others in the room that just don't.
Right. And when you're younger, it's good to have, big muscles. But as we kind of mature, it's a little bit better to focus on the strength and the plasticity of the tendons. So doing more stretching and making sure that you're doing maybe a lower lift weight and doing a little bit more repetition is kind of a better focus. So that those tendons are strong instead of having these huge muscles.
Yeah.
So.
Okay, well that makes sense. So yoga is what I'm hearing.
Tai Chi, yoga, for sure.
Perfect. Awesome. Yeah. Well, I am not as grossed out as I thought I would be after this, Dr. Harper.
Well.
So thank you very much. I don't think I got pale or anything, except when you mentioned the double needle part. That made me a little
shaky.
lightheaded. Anyway, Dr. Hollan Harper, primary care sports medicine physician at Monument Health's Orthopedic and Specialty Hospital, and Kaleh Knutson, the nurse practitioner that works with Dr. Harper. Thank you again, both for coming in.
For sure.
And if you ever want to talk about, I don't know, maybe we'll just do a whole one on tennis elbow instead. I don't know. Whatever you guys want to talk about, I'm here. Ready.
Happy to come back.
Awesome. Thank you guys so much for coming in. I appreciate it.